Please don't tell people with CRPS they can treat it with their minds. Yes, exactly. I agree with you. I mean, I think the mind is an incredibly powerful tool, but I don't believe that people with CRPS can just think their pain away. CRPS is not a mental condition. CRPS is a condition involving these very real neurologic changes that happen, these adaptations that happen in the nerves, in the spinal cord, or changes that happen in the brain. It involves your autonomic nervous system and your immune system. And there's a huge sensory processing component, but it's not a mindset issue or a mental health problem. Yes, the condition itself is traumatic. And of course, when you're dealing with this kind of severe pain, it's normal to feel anxious and depressed. Anyone would feel that way. But the pain won't go away with more talk therapy and meditation alone, or thinking positive thoughts. And I know that when I talk about the neuroadaptive approaches, the ones that I use in my program, to some people, it can sound like I'm talking about retraining your mind or changing your thoughts around pain. But really, it's about addressing the physical and physiologic changes that happen in the pain system and addressing how signals are being processed and how sensation is being processed. But unfortunately, comments like these tell me that, sadly, that people really are out there saying that you can treat pain with your mind, which breaks my heart. And honestly, that kind of thing would frustrate me too. But there is more to this condition than psychology. It's hard for people to understand the true nature of this condition because it's so complex. But there is so much new research and science now that's showing that it's not a mental condition and it involves real neurologic changes that make the symptoms so severe and so sensitive. It's not psychology. Now, if this makes sense to you, if this resonates with you, if you want help treating your CRPS in a non-medical way, in a you have to think your pain away kind of approach, right now I have sponsored spots available for my program.